a lot of studies looking at the dangers of fasting looked at people who were malnourished, people who were underweight, which is a completely different concept when you talk about people who are overweight or have diabetes or looking to change their health in ways like that. So it brings up the concept, though, of before we talk about who should be doing fasting, who should not be doing fasting. And again, it's the malnourished people, people who are already underweight, people with eating disorders, certainly people who are pregnant or breastfeeding, and then most kids. And I throw in the term most because if a kid is severely overweight or has diabetes, then intermittent fasting may have a role. But when you talk about the growth trajectory of kids, fasting becomes a little bit more controversial. So certainly should be done under careful watching. But for most adults who don't fit those other criteria, fasting, at least for the short term, is generally pretty healthy. One of the big concerns, though, is if you are taking blood pressure medicines or, more importantly, blood glucose medicines like insulin or SGLT2 inhibitors or sulfonylureas, drugs that can lower your blood glucose, or in the case of SGLT2 inhibitors, can increase a risk of ketoacidosis. If you're taking those medications, you have to work with your doctor with fasting. And anybody with any chronic medical conditions needs to discuss this with your doctor. This podcast, as with all our podcasts, are meant for just some general information for you to assimilate and work with your healthcare provider to make sure you're doing this safely. Because with fasting and taking medications that lower your blood sugar, you can be at risk for dangerously low blood sugar. So please be aware of that, okay? Always important to know who should not be fasting, though, before we talk about who should be. Also, the elderly, the frail, this is not for them, okay? Another concept is how should you feel when you're fasting? And it's okay to be a little bit hungry. It's okay to feel a little bit lower energy. It's okay to have a tiny bit of lightheadedness when you stand up, but you should not feel just wiped out, fatigued, and unwell. You shouldn't feel nauseous. You shouldn't be dizzy all the time. I mean, those are signs that something's going wrong. And on the one hand, it sounds a little silly that I even have to say that, but I've seen people do this because they hear all the benefits of fasting. So they say, I just need to toughen up. I just need to stick through this. Well, no, it's not for everybody. And if you are feeling unwell, stop, drink, and eat, and consult your physician, certainly if it's not going away. So fasting is not supposed to be something that feels awful, that you just have to get yourself through. You know, it's not going to be the most fun thing you do. It's not going to be the most comfortable thing you do. But you shouldn't feel like a struggle the entire time. So that's an important concept as well. All right. Now that we've got all that out of the way, now let's jump into the science a little bit. So part of the problem in talking about the science of fasting, intermittent fasting, or a fasting mimicking diet is the protocols are very different. Are we talking about alternate day fasting where you eat normally for 24 hours and then you do 24 hours of no eating at all, or even 24 hours of like 500 calories? Or are you talking about a week of fasting of just hydration? Or are you talking about a 5-2 pattern where you eat normally for 5 days and fast for 2 days? There are lots of different protocols. Now, interestingly, most of the evidence that I've came across came from this alternate day fasting protocol, 24 hours on, 24 hours off, some with severe calorie restriction, some with no food. But that's where I saw most of the evidence for fasting. And, weight loss is the most consistent finding. Pretty much any fasting protocol, you lose weight. And that makes sense, right? You're not taking in calories, so you're going to start burning your own calories, your own fat for fuel, and you're going to lose weight. That makes sense. But some of the other factors that were pretty impressive and backed by literature is improved blood sugar, improved insulin resistance, lower blood pressure, lower hemoglobin A1C. This is all part of this metabolic syndrome, this metabolic disease that is a lifestyle disease from too many calories, too many carbohydrates. So if you can reduce that with fasting, the evidence shows that those improve. Interestingly, not many of these studies, though, are done on people with diabetes. Most of these studies are done with overweight people, but not necessarily people with diabetes. Now, that's where we can turn to some of these anecdotal reports, some amazing reports by Dr. Firmly and, of course, by Dr. Fung at IDM, that just with 3 days of fasting, they get people off of insulin completely. And there are some published anecdotal reports. Of course, that doesn't mean it happens that way with everybody, but it shows you the power of what it could be used for for patients with diabetes. I'd love to see more studies on patients with diabetes, but for the most part, people are just overweight or insulin resistant. The studies definitely show that those improve. Now, lipids, I find an interesting one. Of course, as a cardiologist, I have to spend a little extra time on lipids. But triglycerides, lower across the board. HDL does tend to go up a little bit with fasting. Probably not as much as if you were eating a high-fat diet, but HDL does go up a little bit. And LDL is interesting because some studies show LDL goes down and some studies show LDL goes up. I think a lot of it has to do with the duration of fasting. For instance, one study from back in 1999 showed that 7 days of fasting increased LDL and ApoB, but shorter terms of fasting can decrease it. And then we don't have as many studies for a week or 2 weeks or 3 weeks, but I'm less concerned with that. In the short term, it can impact LDL. But again, what are we after, right? Personally, as a doctor, I'm not worried about what happens to your labs over the next couple of days or weeks. I want to know what happens to them in the long term. So a big question is this sustainable? And are your lab changes going to be sustainable? And that's where I think the triglycerides are shown to be pretty consistent and stable if you can do intermittent fasting. Whereas the LDL, I'm less convinced that there's going to be a longer term change in the LDL with fasting. Although there was another study in 2013 that showed the LDL size improved, right? So less of the small, denser LDL and more of the larger, less dense LDL with just 10 weeks of alternate day fasting. So I think there is some impact there. And again, that goes along with improving metabolic health. So the science supports in fasting, certainly in alternate day fasting, improved blood sugar, improved insulin, improved blood pressure, and then improved triglycerides, HDL, improved weight, all of the things that go along with this metabolic syndrome. And again, it makes sense. You're lowering your insulin levels, right? And insulin is thought to be a main trigger of this whole metabolic health, that we have too high insulin levels that are just persistently elevated, and fasting is a great way to lower those. Okay. Now, one of the other most important concepts, though, about intermittent fasting is how it differs from chronic caloric restriction. Because remember, I said the concern about chronic caloric restriction was lowering your resting metabolic rate and also losing muscle mass. Those are some of the main concerns of chronic caloric restriction. So intermittent fasting for 1 to 3 days actually increases your resting metabolic rate, which means at rest, you're actually burning more calories. Now, at first, that sounds too good to be true. I'm not taking anything in and I'm burning more calories. But that's what the science shows. Within 1 to 3 days, you actually increase your resting metabolic rate. And it makes sense from an evolutionary standpoint, right? If you're not eating, that means you need to go out and find food. And you're not going to do that as well if your body starts to shut down and decrease your energy expenditure. You need to be able to go out there and have enough energy to find your food. So from an evolutionary standpoint, I think it sort of makes sense. But your body can actually improve your resting metabolic rate for the first 3 days. In addition, your growth hormone increases. And that's important because that can help with muscle growth. So if we're concerned about losing muscle mass in the short term of fasting, it actually looks like our body is smart enough to be able to compensate for that and increase our growth hormone levels